Hi everyone and welcome back. Particularly excited to do this video today since this is the first time we're going to be able to share results from original, hot off the presses research done by myself and colleagues. It's a paper that just came out today in the journal Health Affairs, and it really builds on this idea I laid out in the first video, that there is an economic rationale for strong government response in a pandemic. And that relates to the idea of externalities. So if I myself take precautions to avoid getting coronavirus or spreading it, substantial benefits accrue to other people. Basically, I'm cutting off the node of what could be a source of exponential growth. And so these benefits to others don't fully get accounted for in my own private decision making. So as a result, if you just leave people alone to decide on their own amount of risk tolerance, then you're going to end up with too little prevention relative to what economists would call the social optimum. So that's an idea that makes sense in terms of abstract economic theory. It's not terribly helpful in terms of policy specifics. As economists, what we're really after in cases of externalities or other market failures is what's the minimally invasive level of intervention that can adequately address the externality while interfering with markets as little as possible. And so our research takes a step in that direction by quantifying the impact of several different types of government-imposed restrictions that vary from kind of less stringent to more stringent on slowing the spread of COVID-19. My co-authors and I are health economists. Economics consists of a number of different fields, and each of them specialize in different policy relevant questions related to different sectors of the economy. So people like me spend our careers thinking about health policy and thinking about it from an economic perspective, which means balancing considerations about public health with economic considerations. These measures have obvious catastrophic impacts on an economy, at least in the short run, in closing businesses and schools, banning events, ordering people to stay at home other than for, quote, essential activities, obvious economic consequences, the likes of which we haven't seen in nearly 100 years. And at the same time, these sort of draconian interventions raise some questions about civil liberties that really should give us some pause. So you don't need a PhD in economics to have a pretty good feel for what all of these different restrictions and shutdowns and lockdowns have done to the economy. We really have to grapple with this question of, is the cure worse than the disease? Right? I mean, if you do anything that is resulting in 33 plus million unemployment claims, a third of the labor force in Kentucky being, temporarily out of work, then it darn well better be doing something, extremely helpful on the other side. If it turns out that these measures really didn't do much, in terms of promoting public health, well, then the economic damage would obviously suggest that we should undo them as fast as possible. And so then let's look at that economic damage alongside, some stylized facts about COVID-19. The feared overwhelming of the healthcare system, outside really of the New York City area, has just not happened in the US. We've had about 1.4 million confirmed cases of COVID-19 so far. That's a big number, but US population is well over 300 million. In particular, if you look at it alongside the projections of, by this point, 100 million plus infections. So, realizing there's a number of asymptomatic or mild cases that go undetected, but still 1.4 million compared to 100 million, it doesn't look like the dire scenarios have panned out. And on the death side, over 80,000 deaths so far. That's nothing to make light of, certainly. But the projections were for up to 2.2 million deaths. And what we're seeing is this economic catastrophe coming alongside the fears, the public health fears that led to these draconian measures, not really seeming like they've been materialized. And so you're getting a lot of questions. Is the cure worse than the disease? Now, the important thing that logic misses is that we don't know if the worst case public health projections didn't come about because just the models were wrong and the whole thing was just an overreaction. A lot of people are assuming that to be the case just by looking at the facts on the ground, but we don't know that. The other possibility is simply that something like those worst case scenarios would have happened, but we avoided them through extensive social distancing. In a case like that, that doesn't make the economic damage any less real, but it does mean that, maybe, sort of necessary in light of the alternative. In a case like that, it's important to know because that really guides policy choices going forward. Do we continue with these sorts of measures? And if so, what types of measures until we're out to the other side? What we find is it's kind of two to two. Two types of interventions. We find pretty clear evidence that they gradually but ultimately substantially slowed the spread. And those were the closures of entertainment-related businesses and then these shelter-in-place orders. Whereas we're finding no evidence that closing the public schools or banning events of over a certain size did anything, at least prior to the other stronger measures coming along later. In terms of thinking like an economist, where you're looking for the minimally invasive, effective intervention, this is actually kind of the worst possible news, right? Because the lighter measures, we can't find any evidence did anything. The stronger measures really did a lot. And so you don't have kind of an easy answer here, like, well, just, let everything else open back up, but just put a lid on event size, and keep the schools maybe closed. You don't have that as, a viable option, really. It's kind of hit hard or don't hit at all. So we're studying state and local government social distancing restrictions rolled out across March and April. And what we're taking advantage of here is that the types of restrictions and the timing of those restrictions varied across space. They did tend to follow a similar general pattern, though, which was to begin with less extreme measures, closing the public schools, banning events over a certain size, and then from there progressing to shutting down entertainment-related businesses, things like restaurants, bars, gyms, playhouses, etc. And then finally culminating with these shelter-in-place or stay-at-home orders. And those stay-at-home orders tended to have two parts to them. One is shutting down other, all remaining, quote, non-essential businesses, so think retailers. And then these directives to stay at home other than for essential activities. So this pattern of starting lighter and getting more stringent and more draconian. So what we're doing is using just publicly available case numbers for each county on each day during the period March 1st through April 27th. And we're just looking at the effect of each of these four different types of social distancing restrictions on the daily percentage growth rate of confirmed COVID-19 cases. We can take these results and run some pretty interesting simulations to kind of see what did happen and what would have happened. The green curve is what we predict the daily growth rate would have been without any government-imposed social distancing restrictions. Now, and then the red curve is if you do everything except the stay-at-home orders, and then the blue curve is you turn the stay-at-home orders on too. So the blue curve then is what we actually observed in reality. Now you see the curves all track each other closely at the beginning. That's because the measures didn't start until March 10th. And then after that, there's a little time before they actually turned into savings in confirmed cases. So there's a few interesting observations. So this is daily percent growth rate. See, it takes a little while to ramp up, probably didn't have adequate testing at the beginning and so on. But once it really gets rolling, kind of later half of March, settling in around 20-25% growth per day in the scenario where we didn't do any restrictions. Even in that scenario, though, the growth rate falls. We go from a peak of 28% per day all the way down to 14%. So it's cut in half. So what is that? With exponential growth, what you would expect would happen is that once things got rolling, you'd continue to move along, like this would be a horizontal line, that you'd continue to move along at a constant percentage growth rate, and that's what makes it exponential. But what this green line is telling us is that even in the absence of any government-imposed restrictions, you're still flattening the curve about in half. Okay, and so what is that? Well, that's, most likely explanation is that's voluntary social distancing. People and businesses making their own choices to kind of stay at home or limit activities, etc., or wash their hands more, whatever, just in response to information and guidelines. So the green line is really still fairly powerful evidence that people do stuff on their own without the government coming on top. Problem with that, though, is that you see that we got much further by the government coming along and doing more on top, rather than being at leveling off at about a 14% daily growth rate with the shelter-in-place orders, with everything turned on. We got down under 5% growth rate. This graph is showing us, rather than growth rates, just raw numbers of how many cumulative cases we would have had by certain dates. Blue line is reality, orange line with all the other restrictions, no shelter in place orders, gray line without any of the restrictions. What this very clearly shows us is, again, tracking fairly closely, you get a divergence eventually, and by the end, a pretty significant divergence. Now, if you're not looking at the y-axis, you might think that these don't look all that, maybe it doesn't look that dramatic. But then you come over here and you realize we're using a log scale, not a level scale. And so each increment, a progressively larger gap. So when you work all of that out, by the end, by April 27th, the total number of cases, according to our simulation, would have been 35 times higher without these government-imposed restrictions. You're talking about 35 million cases instead of about 1 million by that point. The same team of co-authors and I, a couple weeks ago, put out a study that's much more specific to just Kentucky. We found those numbers about 10 times higher in Kentucky. Kentucky turned on pretty aggressive restrictions. This difference between 10 and 35 is not that Kentucky didn't do as much as other places. It's this is just, we don't have the giant urban areas where you really are getting a lot of this. All things considered, 35 million versus 1 million is a pretty huge difference. So what are the risks of doing the opposite, of opening things back up prematurely? Well, first risk is that you very well might turn what we've documented as cases averted into just cases delayed. That eventually we end up at the same place we would have been all along. We just kind of delayed the inevitable, and with 3 months of cataclysmic economic damage. So given that we are where we are now, staying the course makes sense. There's also a risk in terms of trust in government officials. Georgia's the most famous example so far, but there are a handful of others. If states start reopening, governors start, quote, reopening different sectors of the economy, and at the same time, people are watching the news, reading articles, that this isn't safe, this is going to be a disaster. Are they really going to resume economic activity, right? The restaurants might be open in theory, but they're going to be empty, right? And you're actually already seeing this in Georgia and some other states where things that have been opened back up are still running, 90% or more below pre-crisis levels of volume. And so all you're really doing in that kind of a scenario is putting people out of business the old-fashioned way, just through lack of customers rather than shutdown that, at least in principle, can be accompanied by unemployment benefits or bridge loans, et cetera. So to that point, when will the economy truly come roaring back? You can't, people are too smart. You can't just say everything's okay and, flip the switch, let's all go back and, forget that all happened, right? When the economy will truly come roaring back is when fear is gone, when consumer confidence is back, right? And so think of economic recovery as really being a race to get to that point. So if you look at it that way, public health and economic objectives are actually not that misaligned. So what would be far worse is this yo-yo where you flip the switch too soon, you have a spike, then you have to go back to shutdown measures, and then you keep going back and forth for 18 months till there's a vaccine. That's where you turn, 3 terrible months economically into 3 terrible years. So what's the role, though, for free market kind of forces to help with this process? If on one hand I'm kind of advocating for being a little more cautious before lifting lockdown measures, well, on the other hand, there is a more market-friendly way to look at this, which is the race is won here. The race to the finish line where fear is gone is going to be won by innovators. The race is to get to a vaccine, really great treatment options, or a complete system of testing and tracing where you can control small outbreaks and keep them from becoming large outbreaks, right? Those, one or all of the above, is when fear is going to go away and the economy can start roaring back. Well, that's about innovation, right? That's about entrepreneurs, that's about, science, et cetera. And, so the government's role in that can be to eliminate regulatory barriers. We've already done a lot of that, in kind of all of those above ways. And then as well to subsidize R&D, right? If you're tossing $1 trillion on the debt with every month that goes by, the return on investment from anything you can throw toward R&D is going to be really, really high. And, so that's kind of the end game there. In the meantime, kind of the last point to make here is that economic relief in terms of small business loans, unemployment, et cetera, needs to be swift and generous. Kind of the usual arguments, pro-free market types of people will make kind of against large expansions of the social safety net really do not apply in a pandemic situation. One of those, the big one, well, you're disincentivizing work if you make it, if you go too generous with the social safety net. Well, is disincentivizing work really an issue when the reason people aren't working is because you have closed down their industries and you are not letting them work? That kind of goes out the window, right? National debt. Well, obviously throwing $1 trillion, every month that goes by on top of the debt is not something you want to do lightly. But there is an important distinction to make between a one-time add-on to the debt versus a few trillion a year in a permanent expansion of government, right? And this is no different than the difference between putting a $10,000 emergency expense on your credit card if it's a really serious, emergency situation, versus using your credit card month after month, year after year to finance a lifestyle you can't afford, right? I mean, one is a good use of credit, one is a bad use of credit, and I do think that that analogy kind of works here, right? And so the worry in that regard is that you end up trying to flip the switch too soon, out of concerns about the debt, and then you just end up yo-yoing for 18 months, and the implications for the debt end up worse than they would have been from just doing it the right way the first time, right? So anyway, all that is to wrap all that up. There are only bad options here. I wish I could have said that our research found that the shutdowns didn't do anything and we should all just go back to work, and this was all was all a hoax, but unfortunately, that's just not the way it went. It's just not the reality of the situation. So all options are bad. Some are less bad than others.